Dr. Ray Fachir from Vet Triage. We're going through this issue of JAVMA, July 1st, 2015. We are talking about ureteral surgery, end-to-end ureteral anastomosis, and double-pigtail ureteral stent placement for treatment of iatrogenic ureteral trauma in two dogs. This is two cases, inadvertent ureteral ligation and transection doing recent ovariohysterectomy. So basically the doctor mistakenly during the spay cut the ureters, which are the tubes that go from the kidney to the urinary bladder, instead of cutting the vascular supply to the ovaries. Clinical findings include stranguria, polyuria, pyrexia, vomiting, diarrhea, stranguria. They say also here that dogs were depressed, which I'm not a fan of using that word because that's a true psychological condition in people. And because we can't talk to dogs, we can't read their minds, they can't talk to us. I don't like using the word depressed. We usually use the word lethargic, so it's a bit weird, JAVMA, for allowing that word in there. Blood work showed hypoalbuminemia, neutrophilia, lymphocytosis, monocytosis. Abdominal ultrasound showed unilateral pylectasia and hydroureter proximal portion. Treatment and outcome: ventral cystotomy, retrograde placement of double pigtail ureteral stent into the ureter and renal pelvis, end-to-end ureteral anastomosis performed over the stent with the aid of operating microscope. Stent position was confirmed via fluoroscopy. Stranguria was seen until stent removal via cystoscopy. 6 to 7 weeks after surgery, ultrasound confirmed resolution of pylectasia and hydroureter. Introduction. The first dog was given propofol, lidocaine, diazepam, isoflurane, oxygen, cefazolin, sodium for surgery. A gap of 6 centimeters was identified between the proximal and distal portions of the ureter and was attributed to the inadvertent ureteral resection. The kidney was moved caudally. That's a procedure called renal descensus, and by freeing it from the retroperitoneal attachment. And the urinary bladder was moved cranially to bring the two ends of the ureter closer together. A ventral cystotomy was performed. The 3 French 12-centimeter double pigtail ureteral stent was inserted in retrograde fashion from urinary bladder into the right kidney pelvis. End-to-end anastomosis over the stent using 7-0 polypropylene suture. Simple interrupted pattern. Microscope used. No spatulation. Cystotomy incision was closed, and they used 2-0 polypropylene to affix the right kidney and the urinary bladder to the body wall to minimize tension on the anastomosis site and decrease mobility of the two organs. So in the top image here, the black and white one, that's an ultrasound showing dilation of the kidney. And then the images here, A and B, the black arrow is showing the cut end point of the ureter in surgery. And then here is the anastomosis when it's all said and done of the ureter. All right. Urogenital ultrasound was performed 6 days after surgery, revealing improvements. And then 7 weeks after surgery, the stent was removed via cystoscopy and contrast fluoroscopy. The second dog was given methadone, ketamine, midazolam, propofol, cefazolin. They used 8-0 nylon suture, simple interrupted pattern with no spatulation for their anastomosis. And then here you can see a fluoroscopy of the pigtail. Here's the pigtail portion of the kidney going down the ureter into the urinary bladder, and this helps protect the anastomosis site. And then here's a contrast study showing beautiful renal pelvis down the ureter into the bladder. So discussion. Such obstructions can occur secondary to intraluminal disease, mural lesions, or extraluminal compression. Common causes are ureteral calculi, neoplasia, blood clots, trauma, inflammation, fibrosis, congenital stenosis, acquired stricture in foreign body, and of course improper placement of ligatures during a spay. Marked increase in ureteral pressure occurs, spreads through the nephron, renal blood flow and glomerular filtration decrease with concurrent release of vasoactive mediators, influx of white blood cells, and fibrosis. The degree of renal damage is proportional to the duration and severity of ureteral obstruction. After 7 days of complete ureteral obstruction, the glomerular filtration rate decreases permanently by 35%. When you have obstruction for 14 days, that decreases by 54% permanently. After ureteral obstruction is relieved, over 24 hours may elapse before ureteral pressure begins to decrease, and it takes over 4 months before renal function is maximally restored. And that's in experimental settings. So So we don't know. And clinically, it's probably even worse in a clinical setting because these animals are usually not normal. So take it for what you will. But also those numbers you need to know for your surgery boards as well if you're studying to be a surgeon. Common signs include urination issues, dysuria, stranguria, polyuria, persistent urinary tract infection, abdominal discomfort, vomiting, inappetence. Again, they say here signs of depression, which if you say signs of depression, I'm okay with that. At least you're saying signs of. But you have to recognize, again, we are humanizing that symptom because that's a real clinical disease in people. It says signs of depression or lethargy. So dumb. Anyway, hydronephrosis, hydroureter, perirenal effusion. They require fluid diuresis, muscle relaxants, and then nephrostomy tube or dialysis. Procedures that are viable include ureteroneocystotomy or ureteral resection and anastomosis. The latter is technically challenging given the small diameter of the canine ureter, 1.3 millimeters to 2.7 millimeters, based on CT scan. Ureteral reobstruction can occur from inflammation and scar tissue and stricture formation, compared with the incidence of other ureteral surgeries such as ureterotomy and ureteroneocystostomy. Ureteral stents are used in veterinary medicine, and human patients with a double-pigtail, multi-fenestrated design comprised of a loop portion that is positioned within the renal pelvis, a long shaft portion that is inserted within the ureteral lumen, another loop portion into the urinary bladder. The loops of the stent anchor the device in the renal pelvis and urinary bladder to prevent stent migration. The multi-fenestrated nature allows urine flow. After the stent is placed into position, the ureter passively dilates, facilitating urine drainage from the kidney into the urinary bladder. Ureteral stents are commonly used in human patients with benign disease like ureteroliths or malignancies, and to provide urinary diversion after ureteral anastomosis. Placement of ureteral stents at the time of ureteral surgery, like with ureterotomy or resection anastomosis or neo-ureterocystostomy, can help minimize post-op complications like urinary leakage and stricture. Ureteral stents can be placed during coleotomy, and minimally invasive techniques can also be used, such as cystoscopic or percutaneous radiological approaches when the patient's size permits it. Temporary placement of a red rubber catheter within the ureteral lumen in a similar manner as the stent placement can also have good outcomes as reported in dogs. Stent placement appeared to have reduced the amount of tension in the anastomosis site caused by the considerable gap between the proximal and distal ureter portions. They did tension relieving techniques, renal descensus, and psoas cystopexy. Signs of lower urinary tract disturbances include dysuria, stranguria, hematuria are reported in 40 to 80% of humans with ureteral stents and are believed to be due to bladder irritation. Other complications of stents in humans include flank pain, UTI, stent migration, stent encrustation. That sounds gross. In humans, the recommendation is that stents be removed or replaced every 3 to 6 months. In cats and dogs, stents are often left in place for longer periods than humans, with few deleterious consequences. Staphylococcus intermedius is commonly isolated from urine samples in humans and dogs with obstructive pyelonephritis. Therefore, they chose cephalosporins in these cases because of those stats. So, these are case reports for an uncommon to rare complication of spays, but it's good to see that we have fancier techniques now to help these animals out instead of considering the alternative, which is probably removing the kidney, which is not the end of the world, but obviously if you can save the kidney, you prefer to do that. All right, guys, I think we've got one more article in this issue of JAVMA before we move on to another one. We'll see you in the next video. Take care.